I didn't want to be muscular. I didn't want to be this big fitness freak. I just wanted to be healthy. And with the why, that's what they're showing me. Not only with the exercise, with the eating, and with the emotional. The emotional part I had to get under control to get here, and they're the ones that have helped me do that.
The physical reasons for me coming to the Y, I had talked with my doctor, I had developed high blood pressure, started taking 2 different medications, and they weren't working very well, and so we were talking about either adding more medicines or changing them again, and she said what you really need to do is start getting active.
Yeah, they love to play video games. I mean, they will sit and play video games for hours if we let them. And that was a big concern to us because with Hunter being like a little bit overweight, that it was from sitting on the couch and watching TV all day. And now, I mean, when we come to the Y, it seems like they have more energy and to get more exercise into our lives so we can enjoy it more and maybe enjoy it longer.
There are countless people who want better health for themselves and their families. People who need continuous support in their relationships and environments. We call them health seekers, and they come from all walks of life. They can be any age, any race. They come from all income and educational levels. They're young, old, single, and families. Some are athletic, some are not. Yet they share a common attribute, a strong desire to improve their overall health, and need continuous support to do so.
You know, I work full-time, so by the time my workday is over, to come home and think about what am I going to make to eat, not only for myself, but for my husband and for my children that is healthy, it is definitely a struggle, and I worry about whether or not I'm feeding them the right things. You know, I don't want to pass on bad habits to my children.
I think that the Y provides more than anything support. They're here, they're fitness coaches that can sit with you and do personal training. Not only are they just trying to, you know, encourage you to be healthier, but they're trying to be on that path with you.
I think the most important thing is that the Y is listening to me. They somehow anticipate what it is that we need, and they provide it.
What can we learn from these people, from these health seekers? In a number of Ys across the country, we have found that health seekers want to make a change, but they need help. They need more support than they have received in the past. They need the YMCA. Why? Because it is an integral part of our mission to focus on improving the health and well-being of the people in our communities. And it's an important part of how the YMCA is responding to the national health crisis that affects all of our communities. Indeed, even though people have access to more information than ever before about how to attain and sustain a healthy lifestyle, only a small percentage of the population can be defined as already active. We can help. Health seekers are estimated to constitute the overwhelming majority of the population. They are the people our mission calls us to support. Yet focusing on health seekers represents a fundamental reorientation for us. In many cases, today we focus much of our attention on those who are already active. To a large extent, these are the people we see in our Ys today. Fortunately, we have learned that reconfiguring for the needs of health seekers does not drive out the already active members. Yet, how do we change? How do we meet the needs of health seekers?
One thing I learned when I came to the Y was that it's not just about your physical well-being, it's about your emotional well-being, about your mind. And the physical activity does help. You know, I take a water exercise class, and I know when I leave, I'm much happier, much more able to deal with my kids and with, you know, normal stresses of daily life.
I feel more confident. Emotionally, even my friends have made comments about my attitude and just the way I look and feel. I have more of a smile on my face. I'm just kind of getting back to the old Madonna. And with that, I mean, I just really can't say enough about what the Y has done for me.
We've learned that health seekers have special needs. They are often more concerned with well-being and health than they are in just being physically fit. They aren't looking for access to facilities and equipment as much as they are seeking the total experience, environment, and relationships that will support their efforts. They require high levels of ongoing coaching, feedback, and personal support. And most importantly, we've learned that to meet the needs of health seekers, we need to readjust our focus.
We have to listen to those who are coming in our doors every single day. And we have to be about building relationships with them. The self-defined health seekers are the people that we have to address their needs. We've got to create an opportunity for them to find a home at the YMCA.
This is going to require significant cultural changes within our organization, and that we're going to have to, for the first time in my YMCA life, is to really identify who our focus is and go after that target market and not apologize to go after that target market.
In order for the YMCA to be successful in this effort, it has to be bigger than the YMCA. We have to engage and involve the entire community in helping meet the needs of the health seekers in our area. This does not need to be about bringing people to our doors all the time. It needs to be about meeting them where they are most comfortable and helping them address their needs.
The bottom line is that reaching health seekers and meeting their needs requires fundamental organizational change. It means building relationships by listening, coaching, partnering, and collaborating. It means having programs that provide the experiences that the health seekers are looking for, based on what we've learned about our members and our communities. And it means creating an environment that fully supports the needs of members and better fosters relationship building. It means moving from predominantly serving the already active to targeting the health seekers and their families. It means moving from membership as a commodity to membership as an experience. And it means moving from simply providing access to facilities and programs to delivering the support that allows health seekers to achieve their goals.
This initiative will not work without a strong focus on relationship building. It needs to be core to everything that we do. When I work with staff here, I don't talk about building facilities, I talk about building relationships.
Because Activate America is not a manual, it is a process. It requires dedication to every day. Where are we today? What are we doing today to learn more about the people we're serving, more about our health seekers, that we can better meet them where they are. It is not about, I checked it off and I'm done.
This is really, really important work for our YMCA. So the challenges are huge, but at the end of this process, we are going to reap all the benefits, as will our community.
As our nation faces an unprecedented lifestyle health crisis due to poor nutrition and inactivity, the YMCA must respond by leading change both within its facilities and within the communities in which it resides. In our facilities, we need to change our program offerings in order to better serve individuals who wish to adopt and sustain healthier lifestyles, but who struggle to do so. We need to deepen our commitment to community-wide efforts outside of our facilities to promote healthy living. We must partner with organizations who share our commitment to creating environments that support healthy lifestyles. We need to sustain the YMCA's reputation as the nation's preeminent community service organization. The only way we can accomplish this is by changing the way we operate to meet the needs of the people who live in our communities. YMCA Activate America is your future, and it is the Y's future.
Over the years, the YMCA's mission has been to build a healthy spirit, mind, and body for all. We know that mission is not simple. Every day brings new challenges. To succeed with Activate America, to engage health seekers, we need to dramatically shift how we focus our work, both inside and outside the YMCA. YUSA is committed to you and helping you achieve this shift in focus. By sharing information and creating a pathway with tools, resources, and experiences to help your YMCA realize the potential of Activate America. No one is better positioned to support health seekers than we are. We need the creativity, passion, energy, and leadership of YMCAs across the country. Please join us